Welcome back. Thank you very much for joining me. My name is Swadik Mayanja, and I am Q the Nurse. And we are on another episode of the Everyday Hero Show. And I am lucky, I am honored to have on the show Wheezy Nurse. Welcome, welcome, welcome.
Thank you.
Better known as Amber. So
Yes.
Amber, welcome.
Thank you very much.
I do really appreciate you coming by, stopping by, coming on the show. It's huge. I love having nurses on the show. I call it the Everyday Hero Show because I consider nurses everyday heroes. The more nurses that come on, the happier Q is. So let's get this party started, okay?
You'll be doing things you don't like doing in order to go on living, that is, to go on doing things you don't like doing, which is stupid. Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
So let's get this started.
Love
So
it.
from the beginning, I want the origin story of Amber. Where are you from, and then why nursing?
Okay. Well, it all started in 1991 when I was born. So, my name is Amber,
Yes.
better known as Wheezy Nurse on Twitter. I am from Massachusetts, have always worked in Massachusetts, went to school in Massachusetts. This is my home.
Well, wonderful.
I graduated in 2013 with my bachelor's and concentrations in biology and women and gender studies.
Okay.
I was always a born leader, so I actually just went back to school a few years ago for my master's in nurse leadership,
Congrats.
and I'm due to graduate in May.
There
Yay!
you go. Congratulations. I mean, that's huge. That's
Thank you,
huge.
yeah.
Okay, so I'm missing something here. So you went, your undergrad, you said what and what? You said you graduated in 2013 with what?
So a bachelor's in nursing,
Oh, okay. And something else.
minors in biology and women and gender studies.
Can we just clap it up for homegirl? Because as a nurse, you may know, you definitely do know, nursing school is hard knocks. Hard knocks.
Yep.
So for you to do that and have a minor, all props to you. All props to you. So you come out of nursing school.
Yep.
Your first nursing job, are you still there? Are you at a different place? What kind of nursing are you doing now? And like, do you plan on going somewhere else? Do you plan on staying until you graduate and then just jumping into your master's program or whatever you decide to do with your master's? Where are you now, and what's the near future plan?
Sure. So my first nursing job was in inpatient psych.
Okay.
I am not there now.
How long were you there?
I was there for 8 months. I had 3 weeks of orientation, and then I was a new grad right on the floor. My first day, I was in charge of the unit.
Ooh,
So that did not bode well.
that's rough.
Yeah.
Wait,
and
that's
then,
a lot.
Yep. So then after that, I went to an easier population. I went into correctional facilities.
Oh, yes.
Yeah, nice and
My
easy.
goodness. My goodness. Wait, this is
Yeah.
getting real.
So I originally thought that I wanted to go into forensic nursing. I was told to get a background in psych and criminalistics, so I did both at the same time. I was working full-time in psych and then per diem in the correctional facilities. So then after that, I found that I wasn't learning as much as I really wanted to, so I had to transition into the hospital setting.
Okay.
So I started working in a community hospital. Once I gained about 2 years of experience in general medicine, I became a travel nurse.
You're a travel nurse?
I am a travel nurse.
Yes. Wait. Pause. Yes. Okay. So this is where it gets exciting. All right. I mean, all of it is real and is important. But personally, and I don't mean to take this out of what you guys want to hear, but travel nursing is definitely a goal. So the fact that you're here, yes, you guys, yes. All right. So you're a travel nurse now. Keep going.
Yes. So I'm a travel nurse right now. Since I still am in school, I'm just traveling around the greater Boston area. So it has been an amazing experience. I have gotten my foot in the door of every major educational and teaching hospital in the city.
That's awesome.
Yeah.
That's just awesome. That's just
Yeah.
awesome. So I want to nosedive into this travel nursing. But before we go there, because I know that's selfish of me, everything you did in the past, it was all psych, and you said you wanted to go into forensic. Is there like a connection between forensic and psych nursing? I thought it was two different. I thought it was like vastly different. I thought like forensic nursing was like you're in the lab most of the day, and like psych nursing
Yes.
is like hardcore.
So, contrary to popular belief, forensic nursing actually encompasses nursing as a general aspect, and then psychology and criminal justice.
Okay.
So there's different facets you can go into with forensic nursing. You can be in a lab if you really want to. You can work within a police department, be a first responder on the scene, collect data and evidence, and then take it back to the lab. You can work in emergency departments and do sexual assault nurse examining. So there's a lot of different things that you can do with forensics, but it's really tough.
And is that still the plan?
I think no.
You think no?
And that's the great thing about nursing. I can try something, and if I don't like it, there's so many different career paths I can take.
Yes, you can say that again. Nursing is one of them careers where you can go anywhere and do anything. Mm-hmm. It is pretty awesome. All right, let's get to what matters. Travel nursing. Travel nursing.
Yes.
So remind me, how long have you been a travel nurse?
About 2 years now.
2 years. So, you said you've been in a whole lot of different hospitals in the city. Do you? How long are how long's the average length of stay when you do go to these cities or to the hospitals? And how? The thing everyone scares me about is the orientation when you do go to these hospitals.
Yeah.
So let's touch a little bit on those two.
Sure. So I would take 13-week contracts in different facilities. So it's just about 3 months.
Okay.
I would go in. The orientation process, it's very quick. It's minimal. And it's because they expect you to hit the ground running. You need to have enough experience going into travel nursing so that you are confident in your skills, and the only thing that you would need to learn is where's the bathroom and where's the clean utility closet. So if you feel confident in your nursing skills and your critical thinking and assessment, then you're going to be fine within travel nursing. But you get a hospital orientation, which is maybe 1 or 2 days, and then you get 1 or 2 shifts on the floor, and then you're done.
Okay, no, see, because that, like, the thing is, it makes sense, right? It makes sense. I've been at the hospital that I'm working at now for a few months, and they've talked about travel nurses that has come by, but the only time hospitals ask for a travel nurse is when they're in need of...
Yep.
So if that travel nurse needs to go through the same length of orientation that a regular nurse needs,
it's not worth it for them.
It's not worth it.
Yep.
It's definitely not worth it.
So if you think of the typical length of a new grad or new staff employee to a hospital, it's about 12 to 16 weeks for an orientation.
Yes.
I come in for 13 weeks. When you're hiring all your new staff, by the time I leave, they're good to go.
Look at this critical thinking, huh? Look at this, or common sense, whichever works. Okay, so you get there, you do your 1 week of orientation, and you're running, you're doing your own thing, right? So, is that something that bothers you? Do you feel comfortable? How nervous? Because I'm so scared all the time, right, at work. But for you to be in a different place every 13 weeks, every 15 weeks, whatever your length of time is, the new people, new place, new everything, how much of that are you comfortable with now, or is it still, like, super scary?
It's always super scary. Whenever you're making a change, especially a big change within different facilities, it's always going to be scary. But if you think about it as a positive rather than a negative, if you think, you know what, I'm going to learn so much more, I'm going to be in a brand new environment that I am now going to take advantage of for learning purposes, for experience, then you're going to be fine. Okay. I tend to be, I don't know if you've noticed, but I tend to be very outgoing. So I don't have a problem asking questions,
yes.
And you need to be comfortable with asking questions. You might have the patient care aspect down, but you're going to need the help of your coworkers that you are working with every shift. Because how do I call the lab to send a sample? Exactly. I don't know. I'm not going to take it down by myself. Like, you need to be able to feel confident and comfortable with yourself in order to ask questions. It's not a weakness.
So out of all the hospitals, you don't have to say a name, but would you pick a single hospital to work at full time, or do you just love traveling so much?
That's the question. That is the question. I love travel nursing because I get to experience new things, new specialties, new people,
yes.
And new facilities. But the reason I got into it was because while I was in grad school, I wanted to see all of the different healthcare systems, see how they work, see which one I would want to work full-time staff at.
Yes.
So right now, I'm getting my foot in the door. Every single travel position that I've had, I've been offered a job for staff.
Congrats.
Thank you. But I want to make sure that it's the right decision for me. I don't want to hastily jump into something because, oh, I got an offer. I want to make sure that it's the right fit for me professionally and for the growth development of me as a person and a professional.
Definitely.
I'm going to get my master's. I want to be able to
grow in that
up.
place,
Yeah.
wherever that place is.
Yep.
And so what type of nursing have you done, and what type of nursing do you think you can stay the longest at?
I have done a lot of general medicine. So I've
Okay.
done medical surgical telemetry to the point where I need specialties now.
Okay.
Chronic disease management. Holy moly.
All day, every day.
Yeah.
I'm gonna
busy.
tell you, yes.
Yeah. It's a lot. I just finished up a contract doing neurosurgical trauma
Okay.
and adored it.
Oh, really?
I loved it.
Wait, really? Oh,
Yeah.
so at my first nursing job, I worked at a rehab, and it was brain injury and stroke patients. So
This is more of med flighting in trauma, like gunshot wounds, stabbings, and then
this is hard knocks.
and then neurosurgical procedures like brain tumors.
Yes.
So
Okay.
this
Oh my
is
God.
very specialized and intricate care, which I liked.
And you enjoyed it.
I loved it.
From
Loved
psych
it.
nursing to intricate trauma. Ooh.
Yeah.
Ooh.
I mean,
Oh my
still
goodness.
kind of bringing it in. We got corrections with the trauma. Now I'm just on the other side of the trauma.
Oh, that's right. That's right.
Yeah.
All right. So I do appreciate that, because I that's something. Travel nursing is something I really, really, really want to do. Before I settle in hardcore, just like you said, just before I settle in, I want to travel. Once you're done school, if you haven't decided on like straight hardcore jumping into like whatever you got your master's in, do you think you're going to travel further than the Northeast?
The opportunities are endless.
Hey, nursing, that's nursing. That's nursing right there. Opportunities are endless. Okay. All right. So, yeah, you've been talking about school quite a bit.
Mhm.
You're getting your master's in
Nurse leadership.
nurse leadership. So, nurse leadership, is that something? Okay. So let's start from the beginning.
Yep.
So you decided to get your master's, right? Do you think you'll ever become an NP? Do you ever think you'll ever, do that path? Or do you want to be advanced practice nursing? Or do you just want to be management behind the desk, not bedside nursing?
I never want to lose bedside nursing. I actually want to integrate it. So I have the role of attending nurse in mind.
Yes.
That I would want to develop within the major Boston area. So
I don't know what an attending nurse is.
Well, I am so happy you asked what it is. So, an attending nurse is sort of like a clinical nurse leader. It's adapting the roles of an educator and a leader and a manager all in the unit, but you're making the connections that you need within the multidisciplinary team and bringing them to the bedside. So, you round on your patients. Every single patient on the unit. What are your goals today? What can I do to make your stay better? Patient satisfaction, optimal patient outcomes.
Okay.
You're focusing on that. Then, hey, you know what? What do I need to do to make that happen? Do I just need to drag the doctor in here to talk to you about your exams? Do I need to get case management or social work involved? Do you want me to get them for you? So round, do as much as you can. Halfway through the day, check in again. Did we achieve these goals yet? Are they achievable today? And then at the end of the day, do the same thing. So it's a leadership position that is still by the bedside. But if the nurses need an extra hand, I can hang a bag of heparin with them. I can change a patient. I can still be with that patient care aspect.
Okay.
But a leader.
But a leader on the unit.
Yes.
Okay, so I'm just trying to wrap my head around this, because you're right. That position, what do you call it?
Attending nurse.
Attending nurse. So an attending nurse, we don't have it at the hospital I am, but it sounds like you are mixing a whole lot of positions that are already there, right? So there's
Yes.
management that takes care of the behind the scenes stuff. We have like a nurse supervisor that helps with the charge nurses that helps with the nurses on the floor on the unit mostly. Supervisors do like the paperwork, a lot of the management stuff as well, and then case management. It sounds like an attending nurse would be really besties with the case manager, because it's case managers do a lot of that stuff.
Yes.
Right.
Care coordination.
Care coordination. That's what you want to do.
Yep.
I feel like nursing is one of the professions that you can, it's super, super, interpersonal, right? You have your patients, you're always with nurses, all of that stuff. But it's also extremely tedious. And that job that you think that you're striving to get is more on the tedious end. It sounds like there's a whole lot of steps, a whole lot of patients. I lose my mind trying to take care of 4 patients. You try to take care of everyone in the unit.
So give me one task to take off the burden of your assignment. Oh, I really need to get social work to come down.
Yes.
So let me page them for you.
Yo, you need to come to my hospital. That's it. We need an attending nurse. We need an attending nurse. That's the end goal. Awesome. Yeah. I mean, that's good. So we've got all this nursing stuff, and I'm happy. We're probably gonna round back around with nursing, but let's talk about how I came to find Amber. How I came to find Wheezy Nurse. All right. So she's the shit, and you need to follow her on Twitter. I'm gonna put the link somewhere. I'm in her handle right here somewhere on the screen, and then in the comment section below. Please go follow her. So Twitter, how long have you been on Twitter? And just how? I feel like it's so hard for me to do Twitter. Tell us about when you started and why you started. Because you have a humongous following. Yeah.
I don't know how it got to this point. So in 2013, when I graduated from college with my bachelor's in nursing, I was studying, I was getting overwhelmed, I was trying to find fun ways to remember material. I was throwing my books at the wall, banging my head against that same wall. I was having such a hard time, and I needed a distraction, but a distraction that could still help me learn.
Okay.
So I went on Facebook, I looked at memes. Memes aren't really going to help me.
No.
I went on Twitter and I followed these hashtags of nursing school problems, nurse life, and I started reading these different things, and it's not just people venting about their shift. It's, hey, I remembered this from nursing school by drawing a picture, and here's my picture.
Yes.
So I started looking at these different tools of remembering material, and I decided I needed to join the Twitter world. So I created an anonymous account, and in the beginning, I loved Lil Wayne. So it was originally Wheezy L Baby, like Wheezy F Baby,
of course.
But Wheezy Lungs L Baby. Yeah, so that was a good one. And it just kind of adapted from there. I became asthmatic nurse, and then I was psych nurse, I was prison nurse, and then I just decided, let me just be me and be Wheezy Nurse.
Beautiful.
So it adapted from there. I started liking and retweeting everyone's tips about nursing school and studying, and then once I started within professional nursing, I started following all these people within psych nursing and within corrections. Then it just kept on expanding. People liked my patient stories about psych and corrections because it's not something that people are used to working with full-time.
No,
so I
not.
gained a really big following with that. And I think it was February 2016 or 17, I'm not sure. Stat News, which is the specialty subset of the Boston Globe.
Yes.
So it covers the health sciences and medicine. They actually mentioned me in an article, top 13 clinicians to follow on Twitter.
Hey.
So that gained me a lot of followers.
Well, ladies and gentlemen, nurses everywhere, understand this.
Yeah.
She's on the show. Good for you. Good for you. So so in the beginning you said it was anonymous. When did you switch from it being anonymous to you deciding I want to be in the spotlight? Like, not spotlight, but I want people to know this is where the stories are coming from. When did that switch, and why did you make that decision?
I made that decision because I wanted to clean everything up. I was really on the humor and sarcasm side, and then I became so passionate about patient advocacy and making sure that patients were satisfied, had optimal outcomes, and I really wanted to focus on that health promotion aspect.
Yes.
So that's when I decided if I hit 40,000 followers, I'm going to show people my face, and I haven't turned back. So
it's
now
hard
people
to
know.
on the internet, but that's a good decision to
Yeah.
not turning back,
Yeah.
because once you're out there, you're out there.
Yep.
You're definitely out there.
I was anonymous until people asked me to start writing blogs for them. So when companies asked me to start being a blog writer, I figured they should at least know my name.
Of course. At least.
At least.
Was there a difference? Did anything change, or was it just your picture's on the thing? Nothing changed. It was all the same.
It's really all the same. The only difference is I put up a selfie every now and then, and people say, "Hi, you're pretty," and I'm like, "Oh, stop!" That's really it.
The thing is, I love that you started out with the hashtags, because Twitter, to me, like when I go on Twitter, I'm like, oh my God, it's so much information. There's so much stuff. And like the fact that our president currently loves to be on Twitter, it is just constant. Like everyone, all day, every day on Twitter, just hardcore, right?
Yep.
How do you sift through the bullshit? Like real talk, because every time I'm on Twitter and like I'm looking for nursing information, nursing stuff, anything to do with nurses, it starts out with nursing, and I'll end up looking at a tweet about some random Kim Kardashian story that started. Right? Yeah. So how do you do that?
I found healthcare companies that I liked and respected.
Of course.
So local organizations that really promote nursing as a profession. I started following the people that they were following, or those that were following those companies.
Okay.
I started looking at those hashtags and the people that were actually contributing to those hashtags regularly. I started following them and sharing their content, and by looking at those targeted people, I found targeted content. So if there's a health advocacy group and I want to learn more about patient outcomes, I look at their content. Okay. And I look at the people that are shared there. So I keep it targeted. You keep it targeted.
I don't know the technicalities of Twitter, right? So, but like, is your feed like everyone else's feed where it's like a million things, or do you like block things out, or you keep it open?
I have a variety of different things that I will follow and I will continue to research. So It's very varied, but I like that. I don't want it all just nursing. I follow emergency personnel. I follow firefighters, all of defense, so correctional officers, police officers. I follow everyone within medicine. I don't just do nursing. But with that, it's all the scope of healthcare.
Of course. Oh, I like that.
I will help you.
Thank you. You guys are my witness. I need the help. God damn it, I need the help on Twitter. Please, please, please help me. So Twitter end goals. Like, is Twitter your favorite social? Like, do you want to be the biggest nurse on Twitter? Like, what is the end goal for you on Twitter? Or is it strictly like information? I love getting feedback. I love putting things out there.
A little bit of both. I would love to be the poster child for nursing, if I could. I mean, there's the sexiest doctor alive, Dr. Mike or whatever on Instagram. Why can't I be the sexiest nurse on Twitter? I don't know. Come on. I mean, maybe then I don't think I want the sexiest, but maybe the most respected.
There you go. I float your boat.
Yeah, whatever. But I love getting random messages that say, I've been following you for years now, and you got me through nursing school. Thank you. I love the little things that I can do to make a big difference in someone else's life. So whether it's sharing a story about a patient that I had and the difficulty that they had and how we worked through it, the patient side and the provider side can learn from that.
Yes.
So I just want to make an impact. I want to influence others in how my practice has taken me forward within nursing.
Goodness gracious. Can you ask for a better guest? I mean, the transition is just too smooth. So I love that you ended it on that. Because that's, like, I started a year ago, maybe a year and a half ago, like when I was in nursing school. But I really got serious at the beginning of this year, like the end of last year, 2017, on social in general, not Twitter, obviously. But I just hit that point where, like, a couple of weeks ago, a month ago, I got my first email saying, I love this. I got my first DM. This is amazing. Like, I was watching and I showed all my nursing friends, and like it just made me want to fight through it and get through nursing school because it's so difficult. But now I see you on the other end, and I can't wait to be there. I'm like, oh God, Oh, like everything else aside, that alone is like worth it, right?
Yep.
That alone is worth it.
It is.
But Twitter, YouTube. So I follow Wheezy Nurse on Twitter, and that's how I knew about her, right? And then I saw that she has a YouTube channel. I have a YouTube channel, obviously, and when did that happen for you? When did you decide? Because Twitter is a very, very different medium than YouTube.
Yeah.
YouTube is videos. There's a lot more like backwork to YouTube, and Twitter. I really like Twitter because you could get the information you want super quickly. But YouTube, you get to know the person behind the information.
Yeah.
When did you make that switch and why?
That's what I wanted. I wanted people to see the real me. I think people can hear my humor and my sarcasm through my tweets, but I wanted them to see me as a real person. So not only talking about nursing problems and the struggles that I have, but also just life in general. I mean, I'm a normal person. I'm a normal human being, and I struggle with a lot of things, like getting out of bed in the morning. But, I mean, I just transitioned over, and it's so hard to transition into a different medium. It's so hard. So I had made a Facebook page, and I had 93 people like it, so I deleted it. I was like, that's not going to happen. It's not working. And that was over a few months. I'm like, I'm not cool there. So then I tried YouTube, and honestly, I just enjoy making the videos.
Yes.
So if people can relate to them, great. I've had a few comments or replies back when I tweet my links that, wow, this is so funny. I do the same thing. This is so relatable. That's all. I mean, I could have 2 subscribers. One, you, the second, my dad. Like, it doesn't matter. As long as I'm reaching one person, then that's all that matters.
I'm happy that you said that because we are nurses, and that's a humongous part of who I am, and I am immensely proud of that. But yes, we are humans first. We are human beings first. We go to sleep too. We like to
don't sleep. I mean,
don't sleep. Whatever you do, you do what people do, right? So I've had a hard time with deciding how much content I want strictly nursing and how much content I want just me, right? Because I am both. I love my nursing, and yes, this is a nurse. I talk about nursing a ton, but there's also a part of me that I would like to share with the world. Do you separate it that way? Twitter, strictly nursing, YouTube, you, or a little bit of both? How do you divide it? If you could make a number percentage, what would it be?
I mix it up. So I've been trying is the key word, a weekly video, Wheezy Wednesdays. So I started out with a few nursing videos because that's what people know me for. So I am a nursing presence. That's what I wanted to start with. After that, I started doing a few singing videos because music is my passion. I love music.
The Christmas.
Yeah, the Christmas one.
I love that.
I did a few more after that. I started to mix it up there because I needed another outlet to sing instead of just my shower. And then I just did a few that are not nursing at all, but just struggles.
Yes.
And just relatable struggles. I think that it's a good balance between the content that I do. I focus a lot on nursing on Twitter, but then also just stress about life. And nursing is all about balance, whether it's within the profession, within your career, and with life. You always have to have a balance, but you need to keep it fresh too.
Oh, most definitely. Most definitely.
Most def.
Yes, so I love this, and I think it's super... It's good to hear. It's good to hear from another person that's doing what I'm doing. I know, like I noticed. So I have this Everyday Hero show, and I ask a lot of the nurses that I work with to come on the show. But a lot of nurses are super type A, they super focused, and they have specific goals, just like Amber does. I want to be this kind of nurse. I'm in master's school. I'm going to get my NP. I'm going to do this, right? And like being in front of the camera, coming on social, all that stuff that means nothing to them. So when I get another nurse that's doing similar things to what I'm doing, that is in front of the camera, that is doing big on social, I get super happy. I can
tell.
Honestly, I'm really happy to see other nurses do this, and I think it's important for us nurses to put ourselves out there. So, big picture stuff. We're good. I got all the information. If there's anything else, just please cut me off. We can talk about that. But let's talk about nursing, and then we'll just do some advice at the end, and we'll wrap it up. favorite thing? What do you love about nursing specific, the profession? When you go into work, what do you love about working as a nurse?
I think the best part about nursing, when I go into work, when I find that I am the most passionate, is when I find out fun things about my patients.
Yes.
So I'll get so excited about these weird random things that I found out because I had to push labetalol or low pressor over 5 minutes, and I'm just hanging out at my patient's bedside, and I'm like,
that awkward 5 minutes.
Yeah, what's going on with your love life? Like, what's up? And then I'll tell the next nurse coming on and report, did you know that the patient in room 5 has a 20-year-old cat?
Exactly.
And she's like, huh? And I'm like, yeah, they give her boluses of IV fluid. What? How funny is that? And they're like, okay.
I do love that.
Or you find out, oh, this patient owns the hospital.
Ooh.
Good thing I found that out now.
Exactly.
So you never know. Ask questions, because I guarantee if you build up a better nurse-patient rapport with your patient, then you're going to get better assessments. You're going to find out a lot of details that might contribute to their medical diagnosis or their care plan and treatment plan just by talking to them, having a conversation.
I mean, the honest truth is, it's too easy to go in the room and then just do the tasks that that your MAR tells you to, the EMAR tells you to do, right? If you have to change the dressing, give them medications, walk with the patient, it's too easy to be like, bing, bang, boom, done. I'm done with this, right?
Yep.
But I would say, like, when you do decide to have the conversation with the patient, and you do find out someone like the most amazing things ever. There's some patients most of our patients are elderly. It's just the world we live in. It's what the world's come to, right? And they've lived life. They know things that we just don't know, right? And when you do talk to them, ask them questions, sometimes you hear the funniest, scariest, most wonderful stories in the world. I agree with you. You.
And even if you don't have time to sit down and talk with a patient, when you have to ambulate them around the unit, hold their hand.
Exactly.
Human connection. That's all it's about. You don't even have to talk. Hold their hand. Use therapeutic silence if they're not feeling well and they don't want to talk. Just be there. That presence, that nursing presence, shows that you care.
Yes.
So every little thing counts.
Love that. I wish I ended on that, but we gotta go on, right? We gotta go on. Your least favorite thing about nursing. The nursing struggle is goddamn real. We all know that. So tell us, what hurts you, what kills you, what's the worst part about nursing for you, Amber?
I think poor communication is one of the worst things. When I do an assessment and doctors don't come to the bedside to follow up with my assessment, with the whole multidisciplinary team, if people aren't responding back to me, I think communication is key, and I wish it was just a lot more fluid. I wish I could text a doctor and say, please come by at 2:15 when family will be here. I mean, half the time they're not reading their pages until after 2:15. I mean, everyone's always on their phone, so let me text you on your phone, or let me find you.
Yes.
Put a tracker on everyone or something. I don't know. But communication lacks in a lot of facilities, and we need to improve it.
That's a really good point. And you being a travel nurse, bringing it all the way back to there, it is difficult, right? So I know, being at the hospital I work at, I know the good doctors, like who I need to talk to get the answer quicker.
Yep.
Right? I know who the case manager I need to get the transportation situation home fast. I know the nurses I can go to that is definitely going to help me, and I don't have to ask 5 different nurses to get the answer or to get the help that I need. Being a travel nurse, I feel like communication must be just mind-numbing, because I know, just being at the hospital every single day for all my shifts, it's difficult. It is difficult. But you going in not knowing anything on that end must suck.
I had a doctor at one of my travel assignments. I was only there for 13 weeks. I had a doctor come to the floor and tap me on the shoulder. He's like, hey, you paged me? I'm like, yeah. Did you get it? You didn't put your name in the page, but you said, thanks so much, ! Smiley face, that I knew it was you. And I'm like, So, politeness got me the orders that I wanted, but they also knew who I was.
That's nice.
So.
I mean, that right there is really good. I don't know what that says about the other nurses that work on the floor, the politeness situation, but good for you.
Yeah.
So they knew it has to be the new nurse because I know the rest of these folks.
They're not gonna put in a smiley face in the page.
I do like that. Communication is key because teamwork makes the dream work.
Oh, baby, that's my phrase.
Yes.
Say it all the time.
You see this? You see this? Okay. All right. So I call you an everyday hero, right? I want to be. I want the following Wheezy nurse has on Twitter. I want that, right? So give me and the rest of the nurses in the world some advice. I want two things. Number one, advice on just for new nurses coming into nursing, for nurses that work at hospitals, hardcore, been there for years, that are receiving a travel nurse. What advice do you have to them to accepting a nurse, to being a travel nurse, and just making things better on the unit?
So new nurses going into facilities, it's overwhelming. It's crazy, especially if you're a new grad, because you're trying to sift through all of this education that you've received in nursing school and apply it. There's only so much you can do within your clinical experiences within nursing school. Yes. Now it's the real deal, and patients' lives are on the line. So as a new grad, never be afraid to ask questions. If you're not comfortable doing something on your own, sometimes I'm not comfortable doing things on my own, and I'm like, hey, do you mind just watching me do this?
Yes.
Can you just tell me that I am doing this right so I can improve my practice? Just ask questions, because if you make one mistake because you're overconfident or you don't know what you're doing and you're just going to do it, you're going to hurt someone. And it's not good.
Exactly.
Unacceptable, and it's avoidable. It's an avoidable error because you could have asked. And there's tons of resources. If you don't want to ask, you can look up a policy, look up a protocol, see how it's done. I mean, it takes 2 minutes. Yes, it's an extra task that you have to put on your checklist of things to do, but you're saving a patient.
Yes.
So, yeah. And as far as accepting travel nurses within facilities, important. I think if you think of it in the realm of, we're short-staffed, and I don't want to work overtime, I don't want to be forced, so let's be nice to this travel nurse that's helping us with our staffing, it'll be a lot more accepting. I mean, I'm here to help you. I'm here to pick up all of the shifts that you don't want to work or that you can't work. So if you think of it in that way, I mean, everyone should accept travel nurses.
And be happy about it.
Yeah.
Yes.
We're helping you. We're supplementing your staffing.
Do you work days, nights, both?
Both.
Oh, God.
Day-night rotation.
That is rough.
Yeah.
Good for you. And then last question before we say our goodbyes. And this is not even for nursing, for people out there that want to grow on social. Mm-hmm. Any advice, any tidbits, any strategies that you use to make yourself well known?
To be social in everyday life, what do? You
talk to people.
You talk to people, you make connections, and you network.
Yes.
You got to do the same exact thing behind the keyboard.
Ooh.
Same thing. Be confident. I mean, don't be too creepy, because that can get you into trouble, but be confident. Yes, I really liked that post. Do you mind if I share? Hey, really liked this topic. What else could I learn from this if I wanted to look into it? What can you do to expand your network?
That is huge, right? So I found my favorite social is Instagram. And I found literally day and night difference, right? There's a difference between liking a post and saying cool pic, right? Then liking a post and commenting, you know what? Thinking about that topic that you're talking about, I agree with it because X, Y, and Z. Mm-hmm. That difference between cool pic and having an actual comment, having something that's valuable to someone else,
you're going to get a response.
You're going to get a response. You're going to get someone that comes to your thing and have a conversation with you. And then, yes, your likes are going to go up. Your followers are going to go up. So I agree with that 1,000%. Like that, like if you actually care, then it shows. It shows, even though it's behind the keyboard.
Yep. You need to be politely aggressive. Don't just do yes or no's. Great, that's pretty awesome. Hey, I really like this because...
I love that. Not passive aggressive, politely aggressive.
Politely aggressive.
Amber coming out with the one-liners. So, Amber, thank you. I truly appreciate this. I think this was super informational. It was fun. You're a great person. Where can we find you? Where do you want us to find you? And yeah, please.
So I would
Plug
love
away.
for everyone to follow me on Twitter. My handle is Wheezy Nurse, Wheezy, like Wheezy Lungs.
There you go.
And my YouTube account is under Wheezy Nurse as well, and you can follow my Wheezy Wednesday posts. I'm really starting to post videos every week, so definitely subscribe and check me out.
Perfect. That was it. That was it.
Good?
That was it.
Good.
Oh, wait. Yes. So don't forget to like and subscribe, comment in the comment section below. All of that information, her links, her handles, all of that stuff is going to be in the description down below. So click them, follow her, like all of it, and have a communication. So talk to us. Let's talk about this situation. Thank you.